Well, it certainly doesn't feel like winter today, like Alex and I were just talking about, but for many people, this time of year brings on a whole range of sadness. First News meteorologist Brian Ivy spoke with some local professionals about the wintertime blues.
For anyone that suffers from depression, you know it can be a struggle. Depression is a chemical imbalance in the brain that triggers feelings of sadness, being hopeless, or worn down. Seasonal Affective Disorder is a kind of depression.
I have a few patients that say, hey doc, December's coming, December 3rd, is kind of my day and I know it's coming, so that's why we can kind of start to plan ahead and to treat that a little bit.
Seasonal Affective Disorder, SAD for short, happens to about 3 million Americans. It's common in women, where it's colder and cloudier. A lack of sunlight is the big culprit. You can help replace it with certain artificial lights.
So 10,000 lux light, and that's kind of the magic number. Anything above that is fine. People sit between 10 and 12 inches from the light for about 30 minutes, usually first thing in the morning. You don't have to look directly at the light, but people can be reading, people can be eating.
It's more common with the elderly. Natural light isn't the only way to help, but it's also a good idea to stay connected to family and friends.
It's really important, especially now, if you can learn the computer, if you can learn to use your phone, if you can keep in contact with family that's not in the area through Facebook or other social medias like that. I think that's really helpful to people.
Whether you suffer from SAD or not, your mood can be improved with living a healthy lifestyle.
So in addition to possible light therapy, to medications, yes, getting enough sleep, following your correct diet, getting some activity and exercise, that definitely helps depression symptoms in general.
In Salem, Brian Ivy, WKBN-27 First News.